Hello everyone, Assalamu alaikum. I'm Tasmin Jahan Mithu, third year student of Prosthetics and Orthotics. Today we are diving into a common wrist condition that affects a lot of people, especially those who do repetitive thumb and wrist movements. It's called the Quervain Tenosynovitis. Before we start, here is a quick breakdown of what I will cover in this video. The Quervain tenosynovitis is an inflammation of the two tendons on the thumb side of the wrist, especially the extensor pollicis brevis and abductor pollicis longus tendon inside the first dorsal compartment. When this area gets inflamed, any thumb or wrist movement becomes painful and restricted. The Quervains usually develop from repetitive thumb use activities like non-stop scrolling, texting, typing, or it also can be lifting babies. And yes, that's why people call it mommy's thumb. It can also be triggered by general overuse, direct wrist injuries, inflammatory conditions like arthritis, or hormonal changes. The common scenario is patients usually complain of pain on the radial side of the wrist, especially when lifting, gripping, or twisting. Patient might also see swelling, tenderness, and difficulty moving the thumb. In severe cases, even holding tight objects can be hurt. Sometimes pain and burning sensation radiate from thumb to all over the forearm. To diagnose the Quervain tenosynovitis, we heavily rely on a clinical test, which is known as a Finkelstein's test. The goal is to reproduce the patient's pain along with the first dorsal compartment, where the abductor pollicis longus and extensor pollicis brevis tendon runs. Ask the patient to make a fist with the thumb inside the fingers. Then gently deviate their wrist towards the ulna. We will see short localized pain along the radial side of the wrist indicate a positive sign. This movement stretches the abductor pollicis longus and extensor pollicis brevis tendon inside the narrow first dorsal compartment. If the seat is inflamed, that stretch produces immediate pain. In the original method, isolates the first dorsal compartment better because the clinician controls the movement. This means the stretch targets exactly the tendon involved in the Quervains, not other wrist structure. The clinician holds the patient's thumb firmly, then it deviates the wrist ulnarly. The patient does not make a fist in the original method. Treatment usually begins conservatively, including resting the wrist and avoid aggravative activities, using a thumb spica, applying ice, taking anti-inflammatory medication, and physiotherapy and stretching exercise. And if the condition becomes severe or chronic, surgical release of the compartment may be recommended. That's a quick but complete overview of the Quervain tenosynovitis. If you found this video helpful, don't forget to like, share, and subscribe. Bye!